Alright, so I'm talking here about what is a naturopathic doctor. A lot of people are going to their conventional doctors. They sit in the waiting room for 2 or 3 hours. They get into their doctor for 2 or 3 minutes. Their doctor hands them another prescription drug, and then they have to see him in 6 months. This isn't working for people. People are not getting better like this. So I'm here to discuss today what is a naturopathic doctor and what are the similarities and what are the differences here. So as you know, your only 3 options of physicians are this. You can go to your MD, you can go to your DO, or you can go to your naturopathic doctor. MDs and DOs essentially mostly prescribe prescription drugs, do surgery, do chemotherapy, put you on some kind of therapy that is a pharmaceutical driven procedure. The difference is naturopathic doctors can also prescribe medications from pharmacies, but they try not to. In fact, I can prescribe any pharmaceutical drug that your MD or DO can. In the last 5 or 6, 7 years, I've probably only prescribed a handful of drugs because I had to for a crisis situation. 99% of the people that come in here with some particular type of complaint, we can usually put them on some kind of herbal treatment, Chinese medicine, IV therapy, acupuncture session, something to this degree. So when people say, well, I'm going to a naturopathic doctor, what does that mean? Naturopathic doctors still have to have the same prerequisites as your regular medical doctor, as your regular DO. We still have to go to college, we still have to graduate with a Bachelor of Science degree or a bachelor's degree with the prerequisites of medical school. We then go to a 4-year licensed naturopathic medical school. It's still 4 years long, we still take all the board exams, the entrance exams, the post exams. Once we graduate, we take the test, we then get our license. Same situation as your regular MD or DO. Board exams are typically taken after the 2nd year, and then you go through your 3rd and 4th year, which are your clinical rotations, and then when you get to your 4th year, you then take another set of board exams. These are your license exams, and this is when you get your actual medical license. All clinical rotations throughout your 3rd and 4th year must be met before you'll actually get your license and before you can graduate from the medical school. One of the things is that the prescribing rights as an MD, a DO, a naturopath are all essentially the same. If you came into myself being a naturopathic doctor, I can still prescribe you your antibiotics. I can still prescribe you certain drug therapies, but I will try to give you nutrition, physician-grade supplements, and different therapies of that sort, instead of going right to a drug, which has usually 7, 8, 9, 10 side effects. Part of the problem is that the fear, or the fear of the unknown with not only people, but other doctors in the community, is that when people are coming in, they don't really know what is a naturopathic doctor, what is their school, what is their training, where does their licensing come from. So when people come in here for their consultations, we try to discuss what is a naturopathic doctor, going over some of the therapies, and try to treat them based on not just masking their symptoms, but getting to the root of their diagnosis. I'm Dr. Joe Brown. If I can help you or answer any questions, whether it be on naturopathic doctors, what is naturopathic medicine, or how we can help you, please give me a phone call.